update conference call. I want to remind you that last month's call, and I was sick. I was coughing and not doing well, so Nakia and Brenda stepped in for me. We did record that call, and there was really valuable information in last month's call as well. So I just want to remind you that that is posted out on our website when you go to the agent portal and you go under videos. We've got a YouTube account, and that'll be where we put that information. So let's start this morning with the March updates. We've got a lot to talk about, and I'll go ahead here. I just, another delay. I don't know what we're up to in terms of number of counts of things that have been delayed for the Affordable Care Act. But before we jump into what was just delayed, remember that last month we shared in our conference call that the 50 to 99 employer group space was delayed from the shared responsibility mandate. Remember that? So in essence, it's funny. We know that the employer mandate got pushed out until 2015. We know that now. But then all of a sudden, they pushed the 50 to 99 space out in terms of the mandate to have to offer coverage to all full-time employees out to another year for those between the 50 and 99. So that group of folks then has until January 1 of 2016. So that, again, kind of think about that as the shared responsibility employer mandate must offer coverage. So that was a delay we talked about last week. So what is this delay? Now, this delay is really around remember when President Obama said, if you like your health plan, you can keep it. Now, as you know, he ran into some trouble with that statement. Even this past winter, like in the late 2013, where people wanted to be able to keep their health plans. And so, as we know here in Iowa, that we didn't have a lot of loss of coverage because Blue Cross, Coventry, United Healthcare all offered that if an individual, a non-grandfathered individual, was in their plan, of course grandfathered as well can stay, but we're really targeting these non-grandfathered folks that were up in arms. President Obama said, well, what are we going to do about this, and how's he kind of backtracking on this? So really what he's saying is, well, if you like your plan, yes, you can keep it. And the carriers in Iowa were already doing that. They'd already pushed those plans out, if you will, until the end of 2014. Well, let's look at this, because this delay then says non-grandfathered coverage in the small group and individual health insurance markets may now delay until October 1st of 2016. So CMS announced in November that if permitted by applicable state authorities, health insurance issuers may choose to continue certain coverage that would otherwise be canceled. And so they're also saying that, and now they didn't, at that point in November, they didn't extend it out to 2016, but they said that those affected individuals and small businesses may choose to re-enroll in any coverage that might have been canceled, okay? So let's keep going here. So what CMS is further stating now, under the transitional policy, non-grandfathered health insurance coverage in the individual or small group market that is renewed for a policy year between January 1 of 2014 and October 1 of 2014 will not be considered out of compliance if they don't move to an ACA plan, right? So ACA plans, we know this as of January 1, that's all that's being new sales are all just ACA plans for new sales. But what they're talking about here, right, is that if I was one of those individuals or small groups that I'd renewed my non-grandfathered, non-ACA plan between January 1 and October 1, I will not be considered out of compliance if I want to go ahead and keep that plan a little bit longer. Now get this, so the states can elect to extend the transitional policy for a shorter period than through October 1, 2016, but may not extend it after that. So what we're wondering here is, what will happen with the state? What will the insurance division do? It really is up to the insurance division. So let's just kind of, before I get there, because we're going to talk about the impact that this has, what's the insurance division going to do? What does this mean to the carriers, ultimately then obviously to us and our clients? So the policy, listen to this though, also applies to large businesses that currently purchase insurance in the large group market. Now remember, large group now is anything over 50, right? So large group is small, or excuse me, I should say large group is defined as over 100, right? Excuse me, I'm getting confused here. Large group, let me read through this and you'll see this, that the large group market as of January 1 of 2016, we know will be redefined by the Affordable Care Act as small business, right? So we're taking right now that's in the exchange and all the rules and regulations from 1 to 50 lives, right? And we know that right now that the small group definition is going to grow up to 100. So let me go back and restate. Sorry, I got a little confused there. So today, the large group definitions, I know there's been a lot of concern around that. What do the carriers call large group? What does the Affordable Care Act call a large group? But what they're saying here is that in this time where this delay has been pushed out, that as of January 1 of 2016, many of those businesses that are in that 50 to 99 are going to be reclassified as part of the small group market. So it's interesting here. So they're saying, again, at the option of the states and health insurance issuers, they too will have the option of renewing their current policies through the policy years beginning on or before October 1 of 2016. So this, I know as confusing as this sounds, you want to think about it in a couple sections here. So look at your current individual and small group businesses in terms of the mandate to have to offer coverage is one avenue that you look at. And then the other avenue is if I don't have an Affordable Care Act plan today, I don't have to get one if I'm individual and small business all the way until October 1 of 2016. So that's the main message here, as confusing, and apologize that I added a little bit to that confusion there. And then when they pull in, what is this doing to large businesses that current purchase their insurance in the large group market, so they're in that 50 to 99 space, and what are they doing? And as we know, the mandate has been pushed out for them to have to offer coverage, but then you get into, do I offer it or not? But if I do offer it, when does it have to be ACA compliant? Okay, so those are really, again, it gets confusing, the two issues here about if I'm an employer, do I have to offer it? And then when do I have to offer ACA compliant plans? So two kind of different conversations, but you see how they become a little interwoven here. So the next issue is, how do the carriers feel about this? What's the insurance division going to do? If you've been reading your emails the last couple days this week, both Coopportunity and Wellmark are kind of, they're asking us to weigh in on this issue with the insurance division. The insurance division hasn't ruled yet. The insurance division may be looking for our feedback. So Coopportunity, of course, is saying, do not delay any longer, state of Iowa, constituents, in Iowa. The carriers, we're here. We're offering product. We have ACA compliant plans. We've rolled these out. The healthcare.gov is working so that we can continue to use that platform. Our ACA compliant plans are here. They're available. For some individuals, they're better. For some small groups, it's better. For some individuals and small groups, maybe the ACA plans are not better, right? But Coopportunity is saying, hey, we're here. We're open for business. We've got over 50,000 people in Iowa and Nebraska. That number is about 20,000 people in Iowa are insured. So, hey, you agents, get out there, tell the insurance division that you don't want them to delay this, right? So I've given the phone numbers there, both the toll-free number as well as the local number to the Iowa Insurance Division. You can call. You can click on the link in the presentation, and or just go to the Iowa Insurance Division website, and it's really it's the online form to file a complaint. It's the way that we can get information to the insurance division about how we feel. Now, on the other hand, Wellmark announced shortly after that, I believe yesterday that came out. Coopportunities, I believe, came out Wednesday, and Wellmark came out with their position on Thursday, which says we are supportive of the delay. Push this thing out. People that have underwritten, that are healthy, that have plans that they like, this is the whole, if you like your health plan, you can keep it. We want to postpone this thing for another couple years. So we're supportive of this. So I'm not surprised, right? We know that Wellmark is not in the exchange today. They have verbally made a commitment that they would be in 2015, but this might change it all. If the insurance division comes back and says, okay, if you want to keep your health plan, you can keep it, and we'll allow carriers to extend those non-ACA plans. Remember, Co-Opportunity doesn't have any non-ACA plans. Wellmark does. How much sense would it make if Wellmark's allowed to postpone the inevitable out till 2016? Why wouldn't they lock those plans in if they're, because they also offer ACA plans, right? They're just not in the exchange where you can get the subsidy. So very interesting going on here. I'm going to just leave it up to all of our agents to look at your constituents and your clients that you serve, and that's how we should make these decisions, right? So depending on your block of business and your community and who you serve, you may weigh one way or the other on this issue. So I haven't seen or heard of any other carriers that have weighed in on this, but I wanted you to know, if you haven't seen it, that's what's going on right now, up to the last couple days of communication. So let's tie this in now to, I was fortunate enough, along with several other representatives from our Iowa Association of Health Underwriters chapter, were able to go to Washington, D.C. a few weeks ago. It was actually the around the 24th, 25th, 26th of February. And it was a fantastic time. And let me just say one more time, if you are serious about this industry, and I know you are because you're on this conference call and you want to stay current, you really, really need to consider becoming a member of Health Underwriters. And one of the things that KHI has done to help you do that is get your interest to Misty Bethel in our office. Misty's extension is 221. You can send her an email, Misty at KHI Solutions. Let her know you'd like to become a member of Health Underwriters. We'll take care of it for you. We'll sign you up, and by going through KHI, we'll put you on a list bill, and you'll get a 3% discount. I know it's not a lot, but we can also deduct that from your commissions on a monthly basis if you'd like, or on an annual basis, or however you'd like to have that done, or you can simply write us a check, but we can secure you a 3% discount if we list bill that. And the more people we get on our list bill, the deeper the discount can be. So now on to my trip and how valuable it was. And the more I continue to stay involved to help you guys know what's going on, I'm telling you, I'll try to communicate the best I can, but you really can't get the full impact of what this is and how ingrained you can get in terms of being the expert in your community until you go out there and you experience it. So really those 3 days or 2.5 days approximately were really spent helping us understand what our association has been doing on our behalf. And trust me, they've been busy. And these people, I've met these people that serve us, that my membership dues goes to these people's salary. And I'm so impressed at the lean team that they have that's serving us and the impact they're making in Washington, D.C. with the people who are making decisions each and every day about how we will be and our constituents, our consumers will be impacted. So we spent a lot of time preparing us to be able to go have meetings with our representatives so that we could speak with authority and conviction to the people that serve us, namely the ones that I got to be in front of. If I wasn't in front of the actual representative or senator, I was in front of their staff. So we were in front of, and I'll just tell you this and then we'll kind of talk about the key issues here, but we got in front of Chuck Grassley. Senator Grassley popped in for about 15 minutes of our meeting, and these meetings all were we'd take about a half hour to 45 minutes. Steve King popped in. I wasn't there when he did, but we were with his staffers for, I bet, almost an hour, and then Representative King joined the team. I scooted on to see Representative Braley, and also then meet the next day with the staffers from Senator Harkin's office. We also had representatives that met with Representative Latham. So very interesting, as you know too, Latham's seat is up and Harkin's seat is up this fall. So again, you've got this political environment out there where seats are up for grabs. And as you know, the whole balance between power in Washington is obviously always something important. So it was an amazing experience, and we talked about these, at least, I mean, more than this, but these were the 5 key issues that we discussed. And I will tell you, if you don't have a copy of this, we are going to post this on our website. It's really, the title of it is Capital Conference 2014, and by the way, they do this in Washington every year about this time. So if you have interest in saying, you know what, one of these years I'd like to go, if you're interested in next year, I think you'll never regret going if you've never been there. So the theme was Agents of Change, Seizing the Opportunity. And I don't know about you, but I have to believe that you that are on this call are all about seizing the opportunity that we have right now in all of this chaos and confusion. So we've got to be willing to change, to look at things a little differently inside of our businesses, and find the opportunity in all of this mess, if you will. So the first one about the role of the agent, this was so important because obviously the things that we talked about in this document that I'm referring to has specifics on each of these points. So you don't have to take serious notes today. I've got the notes right here off of this sheet that we will put out on our website. But it's, you know, we support, obviously, that consumers have the ability to work with a professional like us at any time. We believe that all publicly accessible databases, we need to be part of that. And as you know, there is no broker portal today in healthcare.gov. So we're stating that the broker and the agent has to have a role in this process going forward. And then we talked about having dedicated customer support for us, so that when we call in as agents and brokers, we need a special group of people that understand our role in this and aren't going to put us through the 3rd degree. Once they see that we're marketplace certified, they're going to help us. So we've talked about that. And then, you know, there's some completion of these this broker portal. We want this done sooner than later. So we expect that to be added for next year's open enrollment. So that's the role of the agent and how important that is. And most of the representatives and staffers that we met with, they get it because the constituents are asking for it. And remember, when we go up there, it isn't all about us, right? It's all about what this means to the constituent, and that's how we get our traction. If you would be so kind as to find out in your communities who your local senators and representatives are in Iowa and go to their coffees. They do these, right, these town hall meetings and trying to get out in the community. If you don't know, let me know. I'll help you figure out who your senator and representative is in your area. Mine's Brad Zahn and Jake Highfill. And I know they have newsletters they send out. They have open forum times that we can get together. And I meet with these folks so I can let them know I'm the insurance person. When there's insurance issues, I want to talk to you about what this means to your constituents, to the consumer. Because when we act on their behalf, we have so much more leverage and so much more power. The next issue is all around employer issues. This got really some traction because we've got bipartisan support on a Senate file that's called the Small Business Health Relief Act. We've also got Senate support and House of Representatives support on the 40-hour is a full-time. This 30-hour thing, we know this is detrimental to small businesses and, let's face it, to our general economy. I shared with them my example of giving a healthcare reform seminar up at Iowa Lakes Community College in Emmitsburg. And a woman came up to me after the seminar and said, Lynn, I am one of these being impacted. Today I work here at the college, and I work 35 hours a week, and it's perfect for me. I don't get benefits, and I don't need their benefits. I get them some other way, right? And now we've got the guaranteed issue, so everybody can get insurance some other way. But she said because of the 30-hour definition of full-time, the college now, to maintain their budget, reduced her hours down to 27 hours a week. And I'm sure the employer did that because they didn't want to even be close to 30. So let's knock it down to 27. And she said, Lynn, I don't need the insurance. I don't want the insurance. I get it somewhere else, but I've just lost my income stream. I just lost those 8 or 9 hours a week, and how am I going to get those back? That's real money to me. Those are real dollars I've just lost. So we shared those stories with our representatives to try to get traction on this. Let's move this definition of 30 closer to 40. And what is the number, whether it's 40 or 38, but that's getting some real traction. Now, the sad thing we found is after we come home and we've been up there and we've given them our feedback, again, we're not seeing a lot of movement right now because of this highly political market that we're in, or time that we're in here, because the elections are coming up in November. Now, what we tried to say to them is, wait until these employers get their renewals in September and October, and the constituents find out what they're going to have to move to. Well, do you think that the timing of this recent announcement I just got done telling you about, if you like your health plan, you can keep it, the employer mandate in the 50 to 99 space that a couple months ago or several weeks ago got postponed until 2016. Think about this. So yes, it's in a highly politically charged environment right now, but what we're hoping is this is not going to negatively impact the constituent, the voter, right? That's what's important to them. So it's interesting. We're hoping that we can still get traction on the 40-hour thing, because even though companies, maybe this mandate got pushed out and I don't have to offer it, I do offer it. And so this whole law about 30, remember, in small groups, 1 to 50, in Iowa, 30 still is the definition of full-time employment. So it's interesting. So this whole definition we're looking at moving. That was a big one. That was the big on the employer issues. They've also, under some more employer issues, we've got the age banding recommendation that they moved back to 5 to 1 instead of the 3 to 1. So that's been teed up. Another House bill, bipartisan support once again, to eliminate the $2,000, $4,000 deductible cap for small businesses. That's ridiculous that they have that on there, with the exception if it's just to get to the bronze level. We think that that's not right, that we've teed that up as well with bipartisan support. But is anybody going to act on it yet this year? We don't know. We also talked about a 2-year delay of the national premium tax. That's that HIT tax, they call it. So those are some big things that are impacting the employers. You guys are hearing it. Those ACA taxes and fees, they want us calling them fees, but they're taxes that are being hit on our employer market right now. We're asking for some relief. So know that a lot is rallying around this, and for you to be able to have these talking points and share with your client or prospect that you're working with how plugged in you are to what's going on and what's impacting them, and then let them know to talk to their representatives, because there's nothing like it for a representative to hear directly from their constituent or from a national organization like ours that carries the weight of over 100,000 health insurance, I should say, professionals is who we're representing. So the constituents and then the organizations is who carries the weight. And your clients are also constituents. Another issue now is on market reforms, and this is a big one, very near and dear to our hearts, and that has to do with the market reforms rather around, and I guess I kind of spoke to some of those market reforms. That's the 5 to 1 age banding, and also possibly reviewing the essential benefit and other coverage requirements to assure that they allow everybody the opportunity to buy affordable coverage. The concern is that by making these definitions of essential coverage, essential benefits rather, that it's just priced so many people out of the market. So this is on the market reforms is all around trying to make sure that we have affordable plans. You know, it's not a joking matter, right? But sometimes we joke about where's the affordability in the Affordable Care Act. And so that's where we're trying to address some of these market reform issues to try to get the age banding as well as you know, delaying the taxes a little bit, and then looking at the essential benefits and maybe being able to take out some of that, or at least offer catastrophic coverage to more folks. Okay, then down to the medical loss ratios. On this one, interesting here where they're talking about both, again, bipartisan support. There's an HR 2328, a bipartisan bill, along with a Senate File 650, that would remove once and for all the agent and broker compensation from the minimum loss ratio requirement in the individual and small group markets. And I'll tell you something, this is where many of the carriers are kind of working around it by either having a billing services agreement like Coventry has done. If it's not taken out, then somehow they're saying, hey, you build it in and, you know, put it separately, or we'll run that separately through as a separate line item. But we're just saying we need more competition in this marketplace. And we believe that with the medical loss ratio included in there, that it keeps some competitors from entering this market. And we all know that we need more competitors in this space to provide more affordable solutions and more creative solutions. And I think we've already seen some of that with the onset of Co-Opportunity into the marketplace. I mean, it's stirring it up and mixing it up, but they're coming with a little more creativity maybe and more competition in the market, which then we can see that how prices respond to that. And last but not least, when we talk about containing healthcare costs, here again goes back to this affordability, but really it talks about placing more support on wellness and incentives for employer-sponsored plans, providing for really meaningful wellness programs. So that was a big part of really focusing on wellness. And also the common sense medical liability reforms. And this is kind of, we've talked about tort reform in the past that hasn't been included in the ACA. And also, last but not least, and not to be minimized, but greater transparency of provider quality and cost data so that when somebody goes to have a procedure, they can say, well, how much is this going to cost? And more transparency there. Now, easier said than done, perhaps. We had a great panel that spoke to us. In fact, a wonderful physician from right here in Iowa that's been all over the country and has now come back home to settle, was born here, went away to medical school, practiced in other places. And I've talked to her about perhaps coming to visit us and spending some time talking to us about from the provider community. So I think our local health underwriters organization is looking to tee her up and maybe get another panel of providers to talk about what is going on in some of our communities so that we can try to help drive down these costs. Because it has to do, yes, with transparency, what is it going to cost, you know, what's the charge, but also quality of care. And there can be some misnomers around how people rate quality for physicians. So a lot of good stuff going on there. So if you care to have another conversation with me or get more engaged or involved with health underwriters and what we're doing to try to help bring you the latest and greatest information and also advocate on our behalf, please let me know. And I guess as a follow-up point to this whole thing about our representatives and the political process, I've shared with you before that I'm just blessed to be able to serve on a coalition that represents us as the professionals in our marketplace to the governor and to we along with health underwriters, NAIFA, and the Big I. So I'm just blessed to be on this, as I've said, on this coalition. And so about a month and a half ago, right before I went to Washington, I was in the governor's office, and we had an opportunity to visit with the governor about some of our concerns. And these 5 things I've just listed, we shared with the governor our concern with this federally facilitated marketplace and what would he see happening in Iowa. He did tell us that it is his desire to have an Iowa-based exchange. The concern is how quickly can we get something done. So we won't be ready, he said. We cannot possibly be ready by January 1 of 2015. But he believes that it's wholly possible, and his idea that we would be ready by 1/1 of 16. Now think about how interesting all that is. So if we can have an Iowa-based marketplace that that acknowledges the way the governor understands how important the role of an agent is, and not everybody maybe wants to deal with an agent, but at least promote that they can use an agent, goodness sakes, which didn't clearly happen in the federally facilitated marketplace. We're almost like an afterthought, right? So we want that change. So we communicated that to the governor. The issues that constituents, again, are having, because he keeps very focused on the voters, right, the constituents of Iowa, the consumers of Iowa, what does it mean to them? So anytime we can elevate issues, here's another one. We said there's an error in the marketplace today, the federally facilitated marketplace, and an agent brought this to light that said, when you're trying to put twins on a policy through healthcare.gov, the system won't allow the same date of birth on the same policy. So when you're trying to load a family on there, if you've got mom, dad, and they share the same birth date, right, or you've got mom, dad with twins, that would be more likely. Both kids cannot be added onto the policy today. And so we're trying to raise these issues, not only to Governor Branstad to say this healthcare is the current federally facilitated marketplace has issues. We escalated those, by the way, as well out in Washington. and made sure that they understood. In fact, there's a letter being drafted that a lot of representatives are signing. It doesn't take a bill or law. It just is a letter that we're asking representatives to sign, to send to Kathleen Sebelius, to tell her, please put these issues at the top of your list of fixing the things that are wrong with healthcare.gov. They seem to be not getting the attention that they need. Some of these, they might seem small and minor fixes, which I think many of them are, but they're not getting the attention, and it's dramatically impacting us and the consumer. Like, you can't now decide that I had a navigator help me fill out my application, but now I want to deal with an agent in my marketplace to decide which plan is right for me. You can't add now the agent to the plan so that you become their agent of record and have access to their information. I mean, getting paid is the other piece. That's nice. Hello, right? But how about just being able to help that consumer and add your agent number, and you can't do it today. So we want a place to be able to have 2 agent numbers. So these issues we're bringing not only at the Washington level, but we're bringing those to Governor Branstad and saying these are the issues, and he's all in agreement. You guys, I can't tell you how supportive of our community he is and of what we need to do to help the consumer. So kind of look forward to January 1 of 2016. A lot of work will be done. In the meantime, what we hope will happen, instead of having to get something passed through our legislature, Governor Branstad has the authority, now whether he'll exercise it or not, but has the authority on executive order to be able to define what this marketplace will look like in Iowa and set it up. So barring anything that would look crazy to either side of the aisle, we think we can have something ready, and we hope that'll be by executive order and happen, I'm sure, sometime. If not this year, the work will be done to gather the information, and I get to provide feedback to them on our behalf. So again, if you have things that you want to get to me to make sure that we get, or you have interest in serving in any way, Health Underwriters or on the coalition, just give me a call. Okay, so we're about halfway through the call, and I want to make sure we do have time for questions. So I want to make sure you saw this. As you know, our vehicle to communicate to you is through our news blasts that we push out on an as-needed basis. This one we just pushed out, I believe it was also Wednesday morning. Open enrollment period, a reminder to you, and then what are the deadlines. This is on our website if you didn't get this, and just to make sure that we know, do a last-ditch effort. Do a rally or a call out to your folks that you think haven't changed, if you've run the numbers and they could benefit by moving, or they don't have. I'm still shocked by the number of people that don't have insurance. And let them know, March 31 is the deadline, and then each of these deadlines is a little bit different by carrier, okay? And then a little note here, just see that on the bottom, that when it falls on a weekend, and these do, the applications must be received by the deadline. They don't extend it to the next working day. So make sure that everything's in by the date that it says to the carrier. If you need help with that, please call my staff. We're here to help. I want to also let you know that there are some upcoming meetings, and I'm just so appreciative that we're starting to push meetings out to a little bit more than just the Des Moines or Cedar Rapids area. So we're hitting, of course, Central Iowa, we hit Eastern Iowa, but now we're also, thank you, with Todd Tam's leadership and Marcy Strauss, our programs chair. Those two are serving on our board right now, but they're driving this interest out a little bit further. So in April, there's going to be some more health underwriter meetings. I know there was confusion the last time we did this in January where we brought the carriers in so that you could get eyeball to eyeball with these carrier representatives and hear from them on what's going on, share your concerns. We did these, and we had great success. We did push them out to all 3 of these locations. It is not a KHI-sponsored event. However, KHI was one of the sponsors where we actually contributed financially to health underwriters to sponsor these events and defray some of the costs. So we will push these things out because we believe the more that you have opportunity to get in front of, check it out now. This one, I know it's been filed. I think it's a done deal to get at least 1 credit hour, which we're not really driving CECs right now, but it never hurts if you need them, right? So we're going to be offering this session then from 9 to noon. You've got a Delta Dental CE, and then the Iowa Insurance Commissioner update on what's going on. We don't know that we'll get that CEC, so there could be up to 2 continuing ed credits provided. And then from 11 to 12, we'll give each carrier, they won't get much time, they'll get about 15 minutes to give us their updates, answer questions, but they'll be there mingling. Many of them will come for the whole morning. And so just know that. So we'll be at the Junior Achievement Building in Des Moines on April 10th and April 17th in Cedar Rapids. We have yet to determine the location there. And then April 24th at Kings Point. By the way, if you know of a location that would be available, I think we've tried in the past, used a couple other venues, and I think they're booked. So if you know of somebody that would donate, again, for a good cause, donate a venue that probably could hold, I'm going to say, 40 to 50 people. There in please shoot me an email or Marcy Strauss, either one. Okay? So good stuff coming up. You can register online. Finally, we've got our website through Health Underwriters, and that's at the www.eiahu.org. You can get registered there for those events. And there is a cost for the event, and we do have a differentiator there. If you're a non-member, there's a higher cost. Because we believe the value needs to come, and thank you. Remember, membership in Health Underwriters is only about $375 a year. That's just over $1 a day, right? And so, again, we'll help you with that if you have interest through KHI. We'll help you take care of that if you have interest in joining. But there will be a small fee for members and a higher fee for non-members. Okay. And I've said this again, but again, I just want to repeat it because sometimes people forget that our videos, and this is being recorded, are posted out on our agent portal. So you can get there directly at khiagents.com, or you can get there from our main site, khisolutions.com, and click on Agent Portal. And then remember, being an appointed agent, you log into that portal to get access to this information. So the news that we push out will be there, so you can pull that when I say, hey, we sent this out earlier in the week. You can pull that, or you can come directly to our videos and or slide presentations. When we've recorded it, you'll have it under the videos. If there's not been a recording webinar, but we've got a presentation that we're posting, then we put that under slides. So just know that that's out there. And again, listen in if you can to last month if you missed that one. Again, some really good updates for you there. And also posting some carrier presentations. Okay. I want to share with you guys who have joined the call this morning, just so you know, maybe you've heard there's some scuttlebutt going on in the marketplace. And if you have more questions, we're working on crafting some kind of a message to get out to all KHI agents. But I thought I'm going to go ahead and take this opportunity today to let you know what's going on in the marketplace up to this point. So Wellmark communicated with all its current wholesale contractors. That would be KHI and the rest. There's about 41 of them, I think, out in the marketplace that hold a contract with Wellmark. And they have sent to all contract holders an RFI. We are now working on that. I have that, and I'm working on that along with all the other contract holders with Wellmark today. In terms of wholesalers, and I know I like to use the term wholesalers and retailers, and so a wholesaler would be somebody like KHI that has independent agents writing through them, and then you've got retailers that tend to have their own employees that market directly to the consumer. So as you guys, I think you know this, that we're, of all the wholesalers, we're number 3 in size of those wholesalers that have independent agents that write through them. So we are serious and optimistic about, responding to the RFI, because the point is Wellmark is reducing the number of contract holders. So contracts will be awarded this summer. There will be a reduction in contracts is expected from 41 down to we don't know what of total contract holders. So if it's hard to get to me right now, I'm working. I'm kind of running point on this right now. Like I said, we'll have decisions. There'll be kind of a 2-pass. They'll make a first pass and then a second pass. We'll certainly keep you posted along the process. We fully expect to get a contract, so I don't want to have any concern out there. But everybody has to fill out the request for information, followed by, if you make it through the first pass, followed by a request for proposal to offer Wellmark contracts. What you're going to see here is that Wellmark is probably taking on more of an attitude of, we don't want to have, everybody shouldn't have a Wellmark contract. It's really for those agents and agencies that are really committed to healthcare reform, right, that are really in this 100%. And so that goes for us as the general agencies as well as you agents. So just know that I think there's going to be some agents out there that may not have a Wellmark contract. They've got some things. So we're starting to see some change at the Wellmark level, and I know not all of you run your Wellmark through KHI, and that's fine, so I'm just giving you an update of what's going on overall in the marketplace right now. But another interesting point I thought I'd share is that assuming that not all GAs will get a contract. Again, we hope, I mean, KHI is working diligently. We think we stand a very good shot of getting a contract, but we won't know for sure until a little bit later this late spring and early summer. But what they're going to do is allow all agents to have an opportunity to change general agencies. Now, this is what they're expecting they're going to do. Nothing's been formally written on this, but it only makes sense. There's going to be a little bit of turmoil in the marketplace, and they want to have this turmoil done by the time we get into our next open enrollment period. And I know all of us would appreciate that, right? So there's going to be a little bit of disruption in the marketplace, that if all agents have an opportunity to change general agencies sometime this summer, maybe late summer or into the summer here before we get into the fall, that will happen. Now, we realize that, again, not to be overconfident, but we really believe that we have a very good opportunity, a very good chance to get a general agency contract. We're going to work very hard, do everything we can, of course, to do that. Assuming that we get a contract, there might be some other agents whose current general agency doesn't get a contract. I mean, that's the fact of the matter. That will happen. That we do continue, and we always have, even before a year ago or even before last October when there was another disruption in the marketplace, we've always had our refer an agent program. So if you know of somebody that is looking to get into the business and you refer them to us when they write their first piece, we pay that referral bonus out to you, our agent. This is just an refer an agent program for agents. And then the other option is if somebody currently has a block of business and they move over. Based on a referral from you, then we would also pay you. If they have at least one piece of business, right, then we'd move it. So I just want you to know that that's out there, and maybe you've heard of it, maybe you haven't, but I wanted you to hear it from us and wanted to take this opportunity. So, okay, so that's a big one. I'll just tell you, that's a big one. So we're kind of at that question or comment piece, and just looking at my watch, we've got over 15 minutes to take some questions. So let me go ahead and look to my screen here and see if we've got some questions or we've got some hands that are raised. So I'll go ahead and watch for that. And my first one that comes up, let's see here. You should be able to find your button here that, kind of looking here. Not seeing any questions right at the second here. Maybe you guys are typing some of them. You can raise your hand. There's a little button there on your little screen. And I'll go ahead and unmute Paul. I've got you unmuted if you can hear me, Paul.
I can. Can you hear me?
Yes, thank you.
Okay. I've got a couple questions. One on the come April 1st. What's next for our clients, the individual clients, once they miss the open enrollment? Does it go back to business as usual where all the markets will underwrite accordingly? This is for people that are looking for health care that miss the deadline. That's the first question. And the second one is
individuals, though, right, Paul? Individuals, right?
Yes, just individual. And then on this, the second question is with the individuals with Wellmark. Can we ask some folks that are farmers and they want to move their Wellmark policy over to me, but they're with Farm Bureau, and I don't know how to answer that. So those are the only two that I have right now, Lynn.
Okay. All right, great. I'm going to go ahead and mute you so I don't get feedback, and then if you have another question, you can raise your hand. So the first question, after March 31st, if you've got individual clients, remember too, this is not only the people that are uninsured and don't have insurance today, they're locked out from buying insurance, but it also impacts those that have insurance that have considered making a change. So no one can buy insurance or change their policy after March 31st unless they have a qualifying event during the rest of the year. Now remember, qualifying events are things like loss of group coverage. So if you've talked to somebody that has coverage through an employer and they've talked to you to say, hey, I think I'm going to quit and I'm going to go out on my own or whatever, or I'm going to retire early, remember that's a special enrollment period, and they will get a guaranteed issue policy. So there's really no going back to the old way of pricing, right? You might have people that are still in old non-ACA plans where they had to underwrite, but no new underwritten plans can be written anymore. So after March 31st, all plans written, and there still will be plans written, of course, but they'll be due to a qualifying event. So remember, some of those things when you talk about marriage, divorce, adding dependents, and then the loss of group coverage, those are the really big ones. And there's a list of them, and we've got those. In fact, we put those out in a news flash, but if you need those or you have interest in getting a list of those, give us a holler, and we can get that sent out to you. But that's the only thing. So that should have answered the first one. So individual clients can still buy a guaranteed issue product, but they must have a qualifying event that gives them a special enrollment period to be able to change or buy. And then the policies that you can still get will still be through healthcare.gov, so somebody could still get, you can do that, it just has to be a qualifying event. You can still get a subsidy. Other qualifying events, too, are people that, especially due to either a change in their income status, where they, and a lot of times that has to do with loss of coverage from an employer, so that would give them an enrollment period. But yes, you can still buy through the exchange, get the subsidy. You can buy with Wellmark, with Coventry, with United Healthcare. I mean, so all the carriers are still open, Co-Opportunity on and off the exchange, so all that's still available. Now your second question to do with individuals with Wellmark, specifically Farm Bureau individuals. Wellmark, when they made their decision on the AOR, Agent of Record Change policy, they said, okay, those of you agents who are really getting after it, you can go write, if somebody comes to you and says, hey, I don't know who my agent is, and you can write them a new ACA plan and we'll give you credit. Well, they're only honoring that if you do that from one ACA, one independent agent, rather, to another independent agent. They're saying you cannot AOR a Farm Bureau policy, so in essence they're protecting Farm Bureau and they're protecting their own direct policies inside of Wellmark. So the only thing you can do if there's a Wellmark client today with Farm Bureau that wants to work with you, the only thing that you can do is move them to another carrier. And as you know, if you move them to, I'll just say, Co-Opportunity, for example, and they became your client, then the only time they can move back to Wellmark will be in the next open enrollment period unless they have a qualifying event. So that's the option today. So sorry on that one, but that's Wellmark's position on protecting Farm Bureau and protecting their own direct business. But everybody else is fair game. So, okay, let me go to another question here, and I'll open up, see if Tanya, I've opened your line, Tanya.
Hey, Lynn. The question that I have is regarding the slide where you talked about if people have an insurance policy by January 1st of 2014. And on that slide, it said, if they have that policy by January 1st, but didn't Wellmark and Coventry change their effective date to December 30th or December 31st? So what clients do I need to look at that would have that policy who maybe kept their policy that didn't go to an ACA that has that January 1st, 2014 date?
Well, thank you, Tanya, and I'll go ahead and I'm going to mute you again just so I minimize the feedback here. When you think about it, because Wellmark locked their individual and small group policies along with Coventry and United Healthcare, they locked them in to 12/1 or 12/30 of 2014, remember? So really, they've got their policy has, in terms of between January 1, right, and so they've still, from January 1 on, they've got that old, it's a non-grandfathered, right, but it's a non-ACA plan. So that's the target right there. Those folks, so it's non-grandfathered and non-ACA because they were, as you know, the rule of ACA was supposed to be, everybody was supposed to cut over to a new ACA compliant plan, and the law said in 2014, because they knew that small groups have odd effective dates and, in terms of months, they're not all on January 1. So people maybe would migrate over to the ACA throughout 2014, so that the rule was by the end of 2014, everybody, unless you're grandfathered, would be on an ACA plan. Well, that just isn't what was interesting, because when Wellmark and Coventry and United Healthcare kind of in their wisdom said, well, okay then, we're going to just lock everybody in until the very last day that we can. Some chose 12/1 with some of the groups, and some on the individual chose 12/30. And so they pushed it out, and now that that's been postponed or delayed, you've got all these people sitting there as of January 1 of 2014. They're non-grandfathered, and they have a non-ACA compatible plan. So that's the target market. These folks don't have to move, and really, and most of them, again, they would have moved had the prices been right? And most of us had been out this whole fall and, from October on talking about, is it better for you to move or not? And we've been doing that even January, February, March, right? And in small group, we can continue to do that throughout the year. Remember, small group is not tied to this qualifying event can't move throughout the year. That's just an individual thing. So I don't know if I brought, hopefully I brought some clarity to that, but that whole, on January 1, what do you have? And that's targeting that non-grandfathered, non-ACA plan. Because you'll know as of January 1, there's a lot of folks, January 1 of 14, there's a lot of folks that do have an ACA plan. Or they're buying one now, and if they bought one by March 31st, they'd have a May 1st. So you've got ACA plans that are still being purchased, and those are not the people that we're talking about then. Because it's really, when you think about it, it's really, as confusing as it gets, it's talking first about, okay, the employer does or doesn't have to offer coverage. And then they're talking about, okay, then as a consumer, do I or do I not have to have an ACA compliant plan? And so that whole piece about do I or don't I have to have an ACA compliant plan is what's been pushed out. I don't have to have one now. I can keep what I have, but what we were talking about earlier, now I'm dependent on, number one, the insurance division saying, okay, we'll allow you guys not to have a compliant ACA plan in 2014. And so if the insurance division comes back and says, okay, we'll extend that so you don't have to have an ACA compliant plan, you individual or you small group, then will the carriers also honor that, right? And so that's where Wellmark's weighing in and saying, hey, we're all for it. We'll extend this, we'll go ahead and extend our policies out. Why wouldn't we? And to Paul's point earlier, those are still underwritten policies, right? You can't buy new anymore, but it's always those folks that are still sitting there with those policies. So hopefully that helped bring a little clarity to that. And certainly we can follow up afterwards if we need more. I see Mark's got his hand raised. Hi, Mark.
Hi, Lynn. How are you?
Good. How you? Did you have a question, Mark?
Yes, I do. Can you hear me?
Go ahead. Yep.
Can you hear me?
I can hear you now.
Okay.
Go ahead.
Okay. My question is, what happens to small groups after the enrollment period is over? Can they change in June or May or something to a different small group?
Yes, they can. So remember that this, and unless there's another question, Mark, I'm going to go ahead and mute you so we minimize the feedback.
Mm-hmm.
Okay. So just as I was mentioning a little bit earlier, remember small groups have the opportunity to re-quote, rebid, buy new anytime. They're not held to that requirement of you can only change during open enrollment once a year. So that's only applicable in the individual market, which is still kind of crazy to me that they did that to us, instead of having it year-round like we've always been used to being able to buy and make changes anytime we want in the individual market. So that's not true anymore, but on the small group market, to answer your question, small groups can change, can buy, can cancel, anytime they want. So that's still alive and well. So I think we're going to continue to see employers, especially we've seen some of the small group rates with Co-Opportunity have been really competitive. So if somebody's sitting on a small group plan today and wanted to kind of remain and see what's going to happen, you can shop them anytime this year. It gives you that extra time. And we encourage a lot of that to happen now. Don't wait until this fall when all those 12-1s are going to come due, unless, again, Wellmark and Coventry, and United Healthcare postpone those non-ACA, non-grandfathered small group plans and push those out. Because I'll tell you guys something. Obviously, it would be helpful this fall, but they're just postponing the inevitable, right? Because at some point, all those 12-1s are going to come due. So we are hoping, and we've asked in our last meeting with Wellmark to consider, and hopefully the other carriers as well, consider offering some other incentive to maybe give an 18-month or 15-month rate lock. So start moving people off of this 12-1 that everybody ran to because they wanted to, you know, keep their plan as long as they could and not have to adopt ACA or whatever the case is. And so just know that I think there's going to be some more collaboration, hopefully, between us giving feedback to the carriers. And the carriers don't want it either. They know that the majority of their block then is renewing, and that makes chaos for them, chaos for us. So I just tell you guys, please now target your groups with a 12-1 and start to talk to them now, getting rates, looking at the carrier, seeing it. Hopefully the carriers will start to say, yeah, great, so we'll give you this policy. Would they maybe grant, you know, honor rates longer than 12 months? But if you can lock them in now in June, then they're locked in until June of next year. You've taken them off the 12-1 panic. Okay. Okay, I'm just going to look for another hand raised here. And I don't see any. I'm looking for chats. If you're typing any notes to me and I don't see anything there. As always, we are interested in your feedback. If there are things that we're not addressing that you feel like we need to be addressed, you know, shoot me an email. I do these monthly, as you know. It's always the second Friday of the month from 9 to 10 in the morning. We think an hour is good. We think Friday mornings are good. So if you've got other thoughts. But remember, if this doesn't work for you, just log on to our website and listen to it later on your own time when it works for you. Looking again here to see if I have any other questions. See if there's anything else that we should add here. Gosh, I just know that KHI is committed more than ever to continuing to be a resource for you guys to help you in your business and to be that point of call. And I hope you're getting the kind of service from our staff. And by the way, we will be sending out a survey. I really would appreciate your honest feedback, as you always do. And I think also I'm going to try to add a little box in there that says, if you can type some comments about the type of service or support that we're doing, and you'd be willing, of course, if they're positive, we'd like to post those to our website or reproduce those. Word of mouth, as you guys know, in any business is the best way to find new clients, and so we're always looking for agents that share our same value proposition and our service to the client. So that's what we're all about. We're not about the almighty dollar. We're about serving the client. And if you think there's some other agents out there that might be aligned, you can give us some feedback about how we're doing. We're out to find those agents that want to have an experience that we try to provide you guys. So anything we can do to help, we're interested. And I'm taking one more pass through to see if anybody else has raised a hand or offered a chat. And I don't see anything. So I know we'll be in touch. Listen, real quick before I end, we've got spring/summer training that has been talked about so that we can come out and offer you some more continuing ed and get out in the marketplace. We like to do that at least once a year. And we know that with what's going to be crazy this fall, maybe our CECs should happen sometime this spring and summer or early fall to not be in this whole open enrollment thing with not only Medicare, but then the Affordable Care Act open enrollment and all of our groups trying to renew. So it's just going to be a crazy fall, and we're here to do whatever we can to help. So be watching for upcoming training sessions hosted by KHI with continuing ed and hopefully great benefits again for you guys. So, all right, have a wonderful Friday and a wonderful weekend, and we'll look forward to talking to you soon. Take care. Bye-bye.